All right. I just I just recorded a perfect video for you guys. It lasted 23 minutes. This one's probably going to be shorter because I've already done. It was perfect video, and I can't find what I did with it. So you're going to have to bear with me. This is flipped learning or the flipped classroom. So what is a flipped classroom? Well, first of all, let's take a look at a traditional classroom. Traditional classroom, you go to school, teacher lectures, assigns you homework, and you leave. Oh, excuse me. You leave, you do your homework, you come back. It's the same thing day in, day out. Flipped learning is a little bit different. A flipped classroom is different. What it is I'm going to make a video like the one I have right here, and then I'll post it, and you will watch it for homework. The videos will probably tend to last about 10 minutes. Today it is going to be short or longer because I'm going over with the flipped learning. The benefits to this is you can watch this away from school, at home, in your car, on your way to a sports event, one time, two times, three times, 10 times, as many times as you want to. If you don't have time to squeeze me in or listen to my lecture before you go to bed, maybe you want to wake up at 4:30, 5 o'clock in the morning, and you can get this in. All right? What happens if you don't have a flip video, or you don't have, I'm getting tired, if you don't have a computer access at home? You just bring in those little pluggy things in. I can't even think of it right now. You bring in a flash drive, and we'll put it on your flash drive, and then you can hopefully watch it. And if you can't, we'll figure something out. I'll burn a DVD for you, so you can take it home and you can watch it. Some students last year watched it at their home school before they came in. The trick is it's got to be done before you come to class, because there'll be an activity surrounded by the concepts that you were supposedly have gone over the night before, and then I just reinforce it. So learning, it's supposed to be more beneficial for you. Studies show that it's more beneficial for you, and that it works. So this is your introduction to it. You can watch me as many times as you want. If I'm talking too fast and you want to write your notes down, you can stop me. If you're the type of person that likes to hear and see, then this is perfect for you. And you can stop me. When I'm lecturing in the classroom, you can't stop me. Okay? So let's take a look at the last chapter for Chapter 5. So far we've talked about complete blood counts. We've talked about white blood counts. We've talked about doing looking at hemoglobin, hematocrit, PT, PTT, electrolytes like sodium, potassium, chloride. We looked at urine. We looked at culture and sensitivities. And we looked at, yesterday we looked at the poo. We looked at fecal testing. Today we're going to talk about other kinds of tests that don't necessarily have to do with blood, like, for instance, an EKG, an electrocardiogram. Every muscle in your body is initiated by an electrical impulse, and that's no different than your heart, and you learned that last year. And we can monitor how these electrical impulses travel through the heart through the use of an electrocardiogram. So the purpose of an EKG or an ECG is to monitor how the electrical impulses travel through your heart. And there's a lot that we can see with this ECG reading or an EKG reading. We can look at a 12 lead, and we can determine if you have a left bundle branch block or if you have a right bundle branch block. We can look and see if there's EKG changes that you might have some ischemia or injured tissue of your heart. And what they do is they take these leads, and these leads are electrical wires, and they attach to your torso, okay, and it picks up the electrical activity in your heart. And the activity is converted to a visual image, okay, and that image is the EKG monitor that you see in ICU, or it's the strip that you read. And when we get to the cardiovascular system, nobody is doing EKG technician for their self-study. So, and we have plenty of boys in the classroom. We can, I can show you guys. We can have a whole class demonstration, and I can show you guys how to do an EKG and what to look for in one. So you can go to the doctor, or you're in the hospital and you have chest pain, so they do a stat EKG. You go to a doctor's office for a physical. They can do an EKG at the bedside, or when you're in the doctor's office. Or you can go to your doctor and you can complain, I'm feeling chest flutters, or I'm feeling chest pain when on exertion. Whatever, you're complaining of symptoms. So the doctor does an EKG on you and it doesn't show anything. Well, that's when a doctor will sit there and say, let's order a Holter monitor for you. And you wear the Holter monitor. And the purpose of it is to monitor your electrical activity within your heart over a period of 24 hours. And it can be more than 24 hours. So what they do is they attach the leads to your body, and the Holter monitor itself attaches to the belt or shoulder strap. And you wear it. And you wear it and you resume your everyday activity. It does you no good to wear a Holter monitor and then you sit in a chair because you're afraid to move. You're supposed to move with the Holter monitor on. If you exercise, they want you to exercise. If you stack wood, they want you to stack wood. And they want you to record that activity. And then if you feel symptoms, they want you to record that activity as well. So at the end of the 24-hour period, you can take it to the doctor, and then they look at your journal that you've kept with all the activities that you've done, and they compare it to the readings that they get. Okay? And then they can do some further testing if need be. So that's a Holter monitor. The next thing, the next diagnostic test that we're going to talk about is stress testing. So you wear the Holter monitor, and maybe it shows with exertion that you're having some chest pain or whatever, so they'll order a stress test. Sometimes you may have elevated cholesterol or something, and they want to identify heart disease, so they'll order a stress test. Or you get to a certain age and they order a stress test because they want to see if you're going to have chest pain or shortness of breath or lightheadedness. You're going to have symptoms with exertion. So that's what they do. They order a stress test. So, sorry. So what happens is a patient walks on a treadmill at varying speeds and inclines. They make inclines. They want you to sweat. If you're unable to walk, then they inject a drug that causes a rapid heartbeat that mimics exercise. And they do an EKG and they monitor your blood pressure. Okay? That's what they do. In some cases, radioactive dye is injected into the bloodstream and then an image of the heart's taken. EKG dye images are analyzed for evidence of deficient or not enough blood flow or decreased blood flow to the heart. It can suggest a clogged artery, and then you can get a stent put in or whatever. Scopes. Scopes are things like that they use to visualize. They insert a lit tubular camera, and the tube is probably about as thick as your pencil. Okay? So if I have a pencil, good gravy, not this pencil. That'd be an uncomfortable tube. But if I were to get, not this one either. That's not a pencil though, that's a crayon. That'd be too thick. This pen, it's about the size of a pencil. Okay, that's about how thick the tube is. And there's usually a light on the end of it. And they insert it into a region of your body to obtain a better view. The most common one, shnikes. The most common one is an otoscope. All of you have had an otoscopy done when you were a child. They look inside your ear. That's otoscope. They look inside your ear and look at your eardrum. I told you I had to take our otoscope home to look at Mr. Cowie's ear because a piece of his hearing aid was in his ear and it was causing pain, and he didn't know if there was something in there or not, so I had to double check. I'm sure you guys have heard me talk about that. So an otoscope is the most common one. A bronchoscope is one that looks into your airways. We can call that a bronchoscopy. It's long, flexible tube, and there's a camera on the end. There's usually an extra tube that they can squirt saline in if mucus is too thick, and they want to get a sample, so they can squirt some sterile saline in there to get it. They can insert drugs. They can even suction. They can suction that airway. They can suction fluids. And there's like a little bit of forceps too on the end of them that can take a small tissue sample. Okay, and they can biopsy that. It's usually uncomfortable. Patients are usually sedated or giving numbing agents. All I've ever worked in is an ICU, so all the I was going to say students, all the patients that I've ever had getting a bronchoscopy, they were tubed. They were put on a ventilator. They had that breathing tube inside of them, inside their airway. So I've not seen that done without it. Not saying that it doesn't get done. I'm just saying I've never seen it. A gastroscope is a camera that's used to examine the interior or the inside of your stomach. It's uncomfortable, so the patient's usually sedated. A laparoscope is a camera used to visualize the abdominal region. If you've had your gallbladder out or you've had your appendix out, you could have had an appendectomy done laparoscopically, which means they use that camera. You don't have a 4 to 6 inch incision for your appendix like I do. I have an incision like about that long for my appendix. But for my gallbladder, I've got these little minor incisions that are everywhere because I had it done laparoscopically. Okay? It requires high levels of sedation. It's surgery. A colonoscopy visualizes your colon, right? And it's got the camera. Yesterday we talked about diverticulitis. We talked about cancer growths. We've talked about tumors, hemorrhoids. We talked about all of that stuff. And you can get a colonoscopy and they can look for those things. And I think you guys seen one last year. I'm not sure. If you didn't, when we touch on the GI system, you'll definitely get to see it. Okay, because I think it's important that you guys see that. A cystoscope is used to view the bladder, the inside of the bladder. You can see, this is generally what the scopes look like, even for like a bronchoscopy. This is the eyepiece that the doctor will look in, right? This is the long flexible tube that I said is about the size of your pencil. And here's your bladder. There's usually like a magnifying lens, right, in the camera so that you can see inside. Here's a video connection. It also gives you a light source because it is dark inside the body. Okay, so you can see. The next picture is a picture of a laparoscope. This is a belly. Okay, here you can see here's the insertion site. Here's a tube that they can use to insert saline like they do for a bronchoscopy. They can flush stuff out if it gets too messy. They could probably even suction. That's probably what this side is for. You can see this is his thumbs. But I'm sure a couple of you have had surgery, so you might have had it done laparoscopically. Now we're talking about pulmonary function tests. Pulmonary meaning lungs. So a basic pulmonary function test will measure the flow of air coming in and out of the lungs and the volume of air inhaled by the lungs. If you have lower than normal flows, it can indicate that you have some type of obstructive disease. Obstructive may be due to constriction, like asthma, or emphysema, or chronic bronchitis. Okay. I had a pulmonary function test done at the beginning of the year when I was coughing so much. So it was a basic one, but they have more complex ones where you inhale gases, and then they want to see how well your lungs exchange those gases within your bloodstream. But a pulmonary function test is only as good as the patient's effort that they put into it. If you don't put much effort into it, you're probably going to get a false reading. So if you're the one administering the pulmonary function test, you need to make sure that you're teaching, you're coaching, you're explaining it to the best of your ability. When I talk about good communication skills, this is why you need them. Okay? This is why you need them. Good communication skills are important. The next and the last test that we're going to talk about is when I look at the word, it's hard for me to say, polysomnography. Polysomnography. Oh my gosh. It's a hard word to say. It's a rapid growth. And remember when the guy from Baker came out, Baker's like one of the only schools that has a sleep studies program for this polysomnography. But the purpose of a sleep study is to identify a sleep disorder. Okay? Sleep disorders usually interfere with a person's ability to breathe. Okay? And because it interferes with a person's ability to breathe, it's important. Because if you can't breathe, you can end up with heart disease, memory difficulties, and personality changes. You all know that when you don't get enough sleep, you get cranky. And your memory doesn't work as well. So what happens is, as a patient sleeps, there's certain measurements that we look at. We look at the flow of air that comes in and out of the nose and the mouth. We look at the patient's muscle movements. Okay? When they're attempting to take a breath in, we look at those movements. We look at their brain waves and their eye movement. Remember REM sleep? That was a question, I believe, last year on your state assessment. REM sleep, rapid eye movement, that's when you're in deep sleep. Okay, that's when dreams occur. When you dream, that's when you're in your best sleep. And by looking at the brain waves and the eye movements, they can determine what stage of sleep you're in. They also look at your EKG. They monitor your heart rate and any other beats that are irregular, and they monitor your oxygen in your blood. Because if the oxygen levels are going down, well, then you're probably not breathing. They do this study. By doing it, they can determine if there's a structural problem in the airway that blocks the flow of air, or if the brain's just not telling you to take a breath in while you're sleeping. Okay? So that's why sleep studies are done. I think it's really interesting. Okay, that's all I have for today. I think you guys probably... Okay, so it's not... Okay, the first video that I took that I loved was 23 minutes long. This one's 18, so this one's a little bit shorter. But the whole thing with doing the flip video is if I went too fast, you can stop me. Okay, you can stop me and you can adjust it. If I'm talking too low, then you can raise up the volume. If I'm talking too high, you can take the volume down. Students last year loved this when I did this with bioethics. They felt like it was a one-on-one conversation with them. Yes, I'm looking at you right now and I'm making sure, or you better make sure that you're behaving for the sub. Thank you. And it felt like it was more personal. Okay. So this is just an introduction piece. You're doing it here. The next video that I have, I'm probably going to have you watch it at home. All right. So take your note cards, hand the note cards in tomorrow, and we shall see. I'll talk to you tomorrow. I'll see you definitely tomorrow, and we can talk about how well this went. All right. Good night. Have a good night's sleep, and behave for Miss Noble and Miss L, because you know they'll let me know if you didn't. All right, signing off. Peace out.